Well, everyone, just to let you know, we'll start the presentation in about 30 seconds. All right, hello everyone, and welcome to today's Safety and Health webcast, How to Implement a COVID-19 Vaccination Protocol, Navigating the Often Difficult Waters, sponsored by Traction Guest. This is Alan Ferguson, Associate Editor at Safety and Health Magazine. I'm helping moderate today's pre-recorded event. Thank you all for joining us, and we'll start the presentation in a couple minutes, but first there are some housekeeping items. As a disclaimer, the views of today's speakers and organization are their own and do not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not mean the council or the magazine endorses those items. For today's presentation, we will not conduct a live Q&A session, but we will forward any questions to our sponsor, Traction Guest. You can also email questions to info@tractionguest.com. Also, just to let you know, after this presentation, you'll be asked to complete a brief evaluation survey, and the survey will open in a different screen after this webinar. This webcast will be archived so you can access it after today's live event. To view this webcast and all of our past webcasts, please go to safetyandhealthmagazine.com/events. And with that out of the way, let's begin today's presentation.
Operationalizing vaccine mandates. Today, as was mentioned, I'm joined by my colleagues, Suki Ram and Brian Phillips. They have extensive experience in security, risk, compliance, legal, trust, and other areas. And it's this multiple decades of experience that we're hoping to bring to the table here as we continue this discussion today. I want to start perhaps by setting the table a little bit and describing the hype that I think we're all seeing right now in the media. Unless you've been under a rock for the last 24, 48 hours, and for that matter, for the last 2 weeks, every third article on Facebook, every fourth article on CNN seems to be something related to vaccination policy, vaccination mandates, whether that's local, regional, companies declaring some sort of policy approach. There's something out there, and it's being heavily covered in the media. And that's really why we wanted to have this conversation, to help organizations move perhaps from the hype to a little bit of the reality. And what we're seeing today is that reality is just the starting point. It really is just the tip of the iceberg in terms of what we need to be offering organizations. So, these were quick sample copies that I stole from the interwebs. You see the CEO of Google putting up a public posting, and similarly a CHRO officer putting up, again, a LinkedIn posting. And, I stole this one from our own internal tools. This is Suki's internal posting here at Traction Guest. And it's great. And it's not to knock the policies, especially since they affect me directly. But that really is only the starting point. There's so much more to consider than just the bold statement that vaccinations are required or not required. There's much more to the conversation. And so that's really where I wanted to start today's discussion, really digging into that notion of what is it that we need to think about when we look at policies and operationalizing those policies and turning them into reality, if you will. So with that, I'll turn it over to our panelists. Let's talk a little bit about how you've managed the actual implementation of some of these policies, what you're seeing across the industry in terms of best practices, how organizations are going from sort of a nice piece of paper to something that actually impacts lives. Let's maybe start. I'll kick it over to Suki to start off the conversation.
Yeah, thanks, Roger. It's that nice little piece of paper probably was the easiest thing to do in part of this whole process, right? It's you do a bit of research, and for us it was we're very fortunate. We have 3 offices, but we were really concentrating on our head office in Burnaby in Canada. So for us, it was really looking at we're private sector, so we don't have any actually vaccine mandates. And, we've been looking at it for quite some time. And it was really built out from a conversation within our executive team. And we're very much for, having a safe space for our employees. And for me, in terms of legal and compliance, looking at, what is our obligation to our employees, vaccinated and unvaccinated? And it really boils down to, for us, was, health and safety legislation, which talks about having in place procedures, taking reasonable precautions to protect the health and safety of those workers in our workplace. And the question that we ask ourselves is, have we done enough? What is it that we're doing in terms of precautions? And, the assessment was, having this extra layer of, a vaccine mandate. Is that something that's necessary for our organization? And each organization has to make that determination for themselves, right? And so, going through the research and looking at the assessment, we came to the conclusion that, yes, if you want to attend the office, a vaccine is required. But there's more to that, right? Once you set your policy, you have to look at it like, how are you going to manage this? So we looked at, do we have the necessary tools? Do we have the people in place to be able to push forward this policy? So, when people are coming into the office and, we've had regular attendance over the summer, again, our footfall is not very much. So we are able to manage it quite well. And we looked at really making sure that we're adhering to our requirements to be able to enforce this policy. And it's all about consistency, consistently applying it to make sure that, we don't have complaints of discrimination or unfairness, right? And because one of the risks for us as an organization is, prosecution. If there is an outbreak of COVID within our organization and our efforts to control the exposure were seen to be insufficient. So a policy is just not enough. We have to actually do the legwork to make sure, it's consistently applied. We're reviewing it consistently, and we have the right people in place, trained as well, and the policies and procedure documents to make sure, what we say in our policy is being applied consistently. Again, that goes to training. We had to hire actually a facilities manager specifically for our Burnaby office to be able to do this. So, one of I think the keys for us was early on is having a team that looked at health and safety, because, this is just one policy of many that you will have for health and safety. And again, having early discussions, I think, was really key for us. And then also reviews have been really key for us in terms of once the policy has been implemented, looking at how is it being applied, how do we need to make any sort of adjustments, and then also looking at making sure the awareness and the communication out to the employees is consistent, right? So, where are we communicating to our employees? And with us, in terms of our communication, we use Slack quite heavily. Posting our policies online, posting on an intranet was really key for us. And then also communicating that back to the organization when we have all hands. And having a forum for Q&A as well, and concerns, and making sure that, if there are concerns, then those are being escalated. And then they know where to escalate if there are, exceptions that need to be applied to the process.
So there's a lot going on there. So you certainly have been keeping yourself busy, and that might explain why you haven't returned my emails for the last month and a half. But there's some tooling that has to go on. There's a lot of connecting with other teams and other counterparts within the organization. You mentioned some additional resources. There's a ton of research, and I know because you presented it internally, a lot of research that needs to go on in terms of various policies, and again, the communication and the cultural build up within the organization. So a lot of pieces beyond the piece of paper. I wonder, I'm going to throw it over to Brian to expand even beyond sort of what we've done at Traction Guest as a company. Brian, what are you seeing across maybe the security industry as a best practice? What are other organizations looking at when they think about policy versus implementation?
Yeah, absolutely. So from my standpoint, I look at things, as a matter of compliance and risk, being the security guy in the house. So the first thing that I take into consideration are, the external mandates to have such a policy, whether that's, for or against the matter. But you have to look at, from a governmental perspective, there's multiple layers of mandates involved, right? In In some cases, depending on where your company's headquartered, you may have a federal mandate or a statewide mandate or some, like New York City, for instance, a local mandate involved. And in times they could be conflicting. So making sure that you deconflict all of those, quote unquote mandates and come down with, the policy that works for you. As someone who's always worked for, global companies or even, national companies in this case, this could mean that you have different rules for different facilities. The company I came from before Traction Guest had about 500 facilities around the world. So if you think of 500 different sets of rules, that's almost impossible to manage, right? At least manage without some kind of, as you put it, tooling or process. But what we do in security a lot of times is we come up with the highest common denominator. What's the most restrictive to make sure that we comply and apply that across the board to everyone. So rather than cater to 500 different facilities, we're going to use one process across the board. Again, flexibility in that case, things are ever changing. Whether or not we need to require them or don't require them, who we need to require them for seems to change by the week. So having something, not only a policy, but as you said, the tooling that can be flexible enough along with the changes that we need to make. I think beyond government, yeah.
Nope, go ahead.
Go ahead. I think beyond government mandates, we have to look at, our target customers, especially if we're B2B. As a security director, I've often been pulled into sales cycles. The customer that we are dealing with needs to know that our security is sound as well, or that we're compliant with certain regulations. So making sure that we take that into consideration, who are our customers, especially if we're going to have our employees going on site at other company facilities. Strategic partnerships. I look at insurance. Does insurance come into play? Will they reimburse for some sort of incident? And what do they require us to have done in order for that to be on the table for us? So there's things other than governmental mandates that we have to look at, when we decide our policy. And then, just the last piece on that is making sure that it's all encompassing. We tend to think a lot about our employees. Think about prospective employees. Is this a requirement of new employees coming in? If there's a requirement of current employees, how do we handle the employees that we're interviewing today, right? Coming from Traction Guest, we know a lot about visitors. That's obviously one thing. Again, if you're gonna require it for the employee, do you require it for the visitor that's coming in? And what other requirements do you put on those visitors? Whether that be a valid business need. Is it, you open the doors again and everyone comes on in, or is there sort of, vetting process you need to do for your visitors? And then your contractors as well. I spoke, on the other side of that ticket, talking about your customers, but what about, the people that you're a customer to? And what do you require of those folks that are coming into your workplace? Because again, if you're going to require this of the employees, you should really consider, more of a workplace policy rather than, based on any, one demographic. I think Suki touched on that as well, making sure consistency is the key in your policy there.
Well, that's again, a lot of great points, and particularly I really like the last couple of comments around this notion that, while on the one hand you've got Suki looking at the regulatory implications and what we have to do, and then on the other hand, and they kind of go hand in hand, hopefully, there is a notion of what we should do. And that might be a different set of standards, but making sure that our, not just that our employees are kept safe, but that our customers, those who are paying the bills, are comfortable continuing to do business, and making sure that contractors, entering the door are managed, monitored, screened in whatever manner is most appropriate. So certainly lots to think about, beyond a simplistic, sort of yes, no, are you vaccinated type approach. There's a lot of these nuances that are coming out. I want to maybe dig a little bit deeper into, the notion of vaccination proof, and that often is the anchor for some of these discussions. Policies come out that say everybody has to be vaccinated. Okay, sure. and then it very quickly becomes, well, how do I prove that? And we've heard a lot about different options, vaccine attestation, health attestations, behavioral surveys, government ID. There's all sorts of stuff out there, and I wanted to maybe dig into this and unpack this a little bit. I'm going to pick on Brian maybe first to start off. If you could just explain a little bit more around sort of that top of the iceberg thing around vaccine passports, because they seem to be all the rage. What are they, and maybe how do they fit relative to the other options that are out there?
Yeah, absolutely. The term vaccine passports itself, has even become a bit of a taboo phrase. Some call it a passport, some call it a registry. Some say it's a passport, but we're not going to call it a passport, right? But it all boils down to the idea is that you have some kind of credential. Usually, it's a QR code, and on the back of that QR code is connected to, in most cases, a state database for vaccination records. Where you as a citizen, you put in your identifying information, it locates you, makes sure that you have the vaccine, and then gives you that QR code. On the other end of that, as the business entity, you usually have a scanner app that you can scan that QR code and then see kind of the green check mark, right, or the red X, and make your determination. Obviously, if requiring vaccination is your rule, you need to see that green check mark before you allow entry. Some of the pros and cons with using those systems. I'll start with the pros. I think it's great for a small business. It's set it and forget it, right? You don't need to worry about the underlying architecture. You just simply mandate that your folks have that passport, right? And you get your scanner app and you scan it. Also, very great for retail locations or anywhere that you've got that transient customer base, right? You see someone who comes maybe once a month or so, right? Restaurants, stores, a lot of stadiums use them. Even some of the private passport registries or vaccine passports or registries that are used. In terms of coming from large enterprise, some of the things that I don't like about them is they're, again, it's out of your hands. It's external. They're usually government led, so you don't control the process. They're usually not integratable into the rest of your enterprise applications or enterprise process that you have. One of the biggest things is you don't have a record for auditing purposes that you did the right thing in screening everyone, which of course comes with having no memory for repeated visits. So if we're talking about employees, right, you don't want to bother your employee by having to attest that they're vaccinated every day they come in. So you need some sort of external process or manual process for that. Again, going back to the highest common denominator discussion, they're usually jurisdictional. So like if you have one facility in the state of New York, they have one passport, where the state of California has another, and other states have none, right? So you need something that works across the board. And then the last piece to consider, this is not really a pro or con, just a consideration, is it's one piece of the puzzle, right? We talked about this in the policy discussion. The daily health questionnaire, that's still in, right? There's still the Delta variant and breakthrough infections. So whether you're vaccinated or not, you're still asking, those 3 or 4 questions. And then just general information. Some companies I've talked to have a bit of a signed disclaimer that says, here's what we're doing, here's why, here's what it means to you. Do you understand this? And let us know that you do. Otherwise, if you don't, let's talk about it and get you some more resources and some more information and address your concerns. So just having that scanner app, doesn't, answer those parts of the puzzle there.
No, that's a great point on I guess all of the culture of things, and making sure that there's an educational element as much as there is a policy and procedural element. Brian, you touched on the notion that they're not, the QR codes, the vaccine passports are not integrated with other systems. Can you tell us a little bit more about what that is in terms of, I guess, the siloed nature of these things, and maybe what companies are doing in terms of integrating as best they can, maybe with duct tape solutions and others?
Yeah. So like I said, it's largely so far a state or province-based approach. So each state has their own database that they're tracking the vaccination records. So everything is very exclusive to which state. If you operate within one state, that might suit you, right? But if you're operating across multiple states or even multiple countries, that kind of shoots that in the foot. So there's a lot of private, vaccine passports and other tools out there that give you the full encompassing approach that we talked about, the disclaimers, the waivers, the daily health quiz, the vaccine attestation that come with memory. So it's usually some kind of private, tooling that you're using. And one point that I want to make there too that I probably should have made on the policy side is you want to set the policy first and understand what you need to do to be compliant and to supply the safety that you've got a duty of care to provide to your employees, and then you find the right tooling that fits that process, right? Rather than say, there's this product or something out there on the market, let me just grab this and then mold your policy against it. You need to make sure that you're covering your bases first.
Great. No, that makes sense. So it's as is often the case, there's a bit of a trade-off with the vaccine passports versus more robust approaches, and how you can tie those two together. I want to throw it over to Suki a little bit, and maybe you could talk about what you've done and what you've experienced in terms of the different tools that we're using as proofs, and what was practical in your mind.
Yeah, just touching on what Brian's saying in terms of requiring flexibility, right? You need to be able to be flexible in terms of the proof that you're pulling into your system or you're integrating with. And I think it really comes down to, for us, our proof of vaccination has evolved so much in such a short period of time. Originally we had the paper cards, which had, what vaccine you had at the time and your name. Whereas, now with BC, we have the digital app. But again, there's to the extent that we can use that digital app, even with guidance, and we look to local guidance to say, can we use this and what is appropriate? And it really almost comes down to what is reasonable for each organization, and the organization has to make the assessment for themselves, right? What is reasonable proof to be able to satisfy ourselves that this person is adhering to the policies? And for us, really, it came down to collecting the proof of whatever means it was, if it was the paper copy that they had, or if it was a printout. And again, for us, it's determining, well, do we want to capture that information in our systems? Do we want to hold that information for a long period of time? To what extent do we want to provide access of that information to anyone within the organization? Because you have to be mindful from a privacy perspective, right? Like, who will ultimately have access to this information? And looking at it from a compliance point of view, again, it'll be regional, local, but then an industry expectation. So you are holding on to sensitive information, and what goes on in terms of your requirements when you're holding that. What I would say for us when we were collecting that information, it's also about training the people that are actually collecting that information. And then also looking at when we collect that information, do we necessarily want them to be in office providing us the information, or do we want them to provide it before they get to office? Right? And then how do we present that? We took the view that we were going to be very stringent in terms of data collection. For us, because we don't have that many people in our headquarters, we are able to do a little bit more high touch. But other organizations may not have that, where they need to automate more in terms of pre-collection for them to then process individuals coming through their doors quickly. Whereas we are very fortunate that we have the systems in place that we can do a pre-check. And then they're good to go when they come into the facilities.
Yeah, and to your point, there's a big difference between 3 sites and 300. So lots of challenges. I want to shift gears a little bit and focus now on almost the opposite. We talked about sort of proving the vaccination status, but there's a whole cohort that inevitably will be unvaccinated. And look, the purpose of today's discussion is not to get into the politics of it, and the rights and the wrongs, and the lefts and the rights. It really is a discussion around there is a mandate out there, whether we like it or not. There is also a duty of care consideration out there, whether we like it or not. And it's how do we manage that issue when the cohort, whichever cohort it is, it could be geographically dispersed, it could be demographically dispersed. There will be groups that are unvaccinated, either unable or unwilling to be vaccinated. How do we deal with that scenario? How do we deal with the exceptions to the rule, more so than just how do we deal with the rules? So I wanted to open that up for a little bit of discussion. Suki, looks like you're chomping at the bit there. Why don't you start off?
Yeah, like I think for the easiest thing is, if someone is vaccinated, it's very clear, collecting evidence. Yeah. The workflow is very simple in that way. It gets more complicated when you have individuals, say, raising an exception or us having to make an accommodation. So when we're thinking about implementation, we look at, okay, so what avenues can they raise that exception? So is it through, when they're providing their proof? Is there certain functionality that says, hey, I don't have proof, but I require an exception? So then looking at how does that get escalated, and who does that get escalated to within the organization? Is it your facilities person that's managing that? Or then does that get escalated to a special committee? Or is that something that your people and culture team, your HR team have to do an assessment? And what's key for organizations is documentation, right? And the rationale behind whether to grant an exception, not to grant an exception. That's really going to be key. And again, it's always going to be on a case-by-case basis. So making sure it's scalable. Right. And again, auditing is going to be really key here as well. One of the things in terms of when you look at it from an application, when applying this policy, is consistency and being aware that it's being consistently applied. And then so there is no fear of discrimination or unfairness. So again, those are things that we've been mindful when we put the policy forward and when we're looking at exceptions. And for us, our policy is you have to be fully vaccinated if you're coming into the office. An exception, and one of the accommodations we make is we allow for pure remote work. Some organizations will not have that ability. So then the organization has to determine, okay, what other accommodations are reasonable given that individuals' work requirements. And it may be, for one of the things that we looked at was, COVID testing, then proof of COVID testing, and then that goes into your systems. And then how does that get captured, and what is reasonable in terms of the proof for that? Or then we look at, additional protocol measures for health and safety. So do we have them restricted to a certain area? Do we limit in terms of the meeting room usage if it is that they're unvaccinated? Or again, this all comes back to our obligation for if there is an outbreak and making sure that we are aware who's in facilities as well at the time, and what precautions were taken. And again, almost contract tracing in terms of where everyone is, who's in the building.
No, that's perfect. There's a lot of stuff. And I really like your point about the consistency of these policies and the implementation thereof as part and parcel of how we make sure that we're protecting ourselves down the road from any fallout. So it's one thing to have an implementation, to have a policy. It's one thing to implement that policy, but then it's a whole other thing to apply that consistently so that there is a sense of fairness and equity across the board. Brian, I want to turn it over to you. I wonder if you could dig into some of this a little bit further. In particular, I really like where Suki was going with sort of the escalations and the workflow and the process around that. I wonder if you could talk more around, again, how do we manage the exceptions to the rule in a practical manner?
Absolutely, and I have to say, I agree with all the points that Suki made. I don't think I could have said them better myself, to be honest with you. But I look at this. I don't look at this as vaccinated and unvaccinated. I look at this as a workflow, right? And there's different paths down this workflow. Everyone starts in the same place, and depending on your situation, you go down a different path. And maybe that's you're vaccinated and you have proof of that, and you go down that path. Maybe it's you're vaccinated, but you don't have proof of that. A lot of places are still just rely on that little CDC card, and I know quite a few people who've lost or damaged theirs, right? So what do you do in that case? Maybe one is, I have a medical or religious exemption, or just I'm unwilling to do this, right? And that's your right to do that. So it's a workflow, and you go down a different path, like anything else. And I said it before, and you mentioned it. I think you need some kind of tooling for that, but at least a written process. I think if you're going to be challenged on your practices, this is where you get that challenge. So documentation is of utmost importance here. Write down from here are the different paths that we take. And who has that ultimate responsibility to make that decision that is approved, right? As well as how do you and I think Suki touched on this a little bit, but what classifies as proof, whether that be proof of your successful vaccination, proof of your exemption, if you're just unwilling and your company has decided in lieu of vaccination you'll do testing, what is proof of testing, and what do you do with that information, and how do you validate the authenticity of it?
Perfect. I'm going to use that as a bit of a segue into the next sort of section where I wanted to really dig into the notion of the overarching, I guess, workflow almost. And you both mentioned this idea of the workflow and the escalations. And I want to start putting some of the pieces together. Like we've been talking about, the policy, and we've talked about, different proof of vaccination options thereof, and the fact that, you don't necessarily jump to, vaccination passports, et cetera, but that there are other considerations. We've talked about considerations for the unvaccinated, right? The workflow and escalations, and the exceptionality, the medical exemption cards, and how you make determinations, the religious exceptions, et cetera, et cetera. I want to talk a little bit about, how we put it all together. And, certainly what we've seen out in the market, when I go back to, again, the hype versus the reality, there's a lot of hype about, sort of easy, but maybe incomplete solutions. It's as simple as, oh, are you vaccinated? Yes, no. And then, the person walks in the door. And I think clearly, if nothing else comes from the last, hour of discussion, it has to be this sense that there is more to this story. There is some complexity, and we're doing ourselves a disservice as leaders to ignore some of that complexity. And so there is this bigger process. And I think what we see with a lot of our enterprise or customers is certainly this notion that they are looking at a more end-to-end approach, whereby they are looking at invitation and registration. And Suki, you mentioned this previously, that it's important to engage people long before they get to the office, right? Are we inviting the right people? Are we scheduling accordingly? Or are we putting them in the right desks, in the right spaces, et cetera? Then on the other end, you've got post-event communication, analytics, data. I think, Brian, you mentioned the notion of being able to demonstrate the efficacy of certain programs. So we've got those two sort of ends that I think a lot of people are missing in that overly simple approach, when you only look at the vaccine protocols, when you only look at a vaccination yes, no approval. So I want to dig into a little bit more about the workflow and maybe how that ties in almost to organizational culture and developing a sense of I guess safety and security as something that people are taking seriously, and that is becoming an organizational mandate. So I want to turn it over to the panel again to share a little bit about, again, how this, vaccination proof or unproof for the unvaccinated, how that all ties together in a workflow that is that sort of end-to-end and creates that overarching sense of safety and security. I'll maybe start with Suki, because you've got some very tactical, practical, day of experience with what we've been doing recently. Can you maybe touch a little bit on that, and then we'll turn it over to Brian for some of the industry commentary.
Yeah, no, for sure. Again, this is one policy of many, right? One policy of many, and to a large extent, a vaccine mandated policy is going to be temporary, right? So again, looking at reviewing this consistently with your other policies, your procedures. And for us, we looked at it as it's just an addition to what we already have in place for health and safety. So, we even looked at the policy and looking at even relaxing maybe some of our other health and safety requirements, because right now, if you go in office, you have to be fully masked regardless of your vaccine status. We've got obviously hygiene policies, and then some organizations will already have their health checks in terms of temperature checks. And then have their questionnaires on top of that. So for us, it's all holistic in terms of what are we doing to make sure we reduce the risk for anyone that comes into the organization, and we look at really the movement of individuals within the organization in terms of who's coming in. We monitor that, and so one of the things for us really has been mindful of continuing to review what we have in place, and making sure that we look at any sort of issues that we've had with any of our flows. So one incident that, so what we look at is, people coming into the office and they've done their questionnaire, they provide their proof, but then also checking back with our systems to see, is there any sort of discrepancy? And we've actually had a discrepancy in terms of people that have provided their proof, but actually maybe haven't checked in for the day. So again, it's a constant review and monitoring of the overall flow of individuals coming in and out.
Perfect. Yeah, you raised an interesting point there that there are many, many policies, and this needs to be considered holistically. And I really like your comment. It seems trivial, but hygiene. We've kind of forgotten about some of the basic things, but that may be part of an overarching sort of workforce safety approach where, yes, we're monitoring for vaccination status or exceptions thereof, but at the same time, we're also building out, not just what is the mandate, but what is sort of under that duty of care umbrella. There may be hygiene tips and tricks. There may be reminders about hand washing or mask wearing or what have you to make sure that, again, we're treating our employees and our contractors and our visitors in a way that, raises the bar for everyone. Brian, I wonder if I could throw it over to you for your comments on again, sort of that overall workflow and how people are putting the pieces together for maybe the bigger picture, if you will.
Yeah, I think there's a couple pieces that I could add to what Suki already mentioned. I love what she talked about, the entirety of the workflow from the very beginning to the end. I think in terms of execution and the how, it comes back to what I call your COVID committee. Something that we, at our company, we call it the Safe Work Committee. But it's something that we started at the very beginning when we were drafting our, return to the office playbooks that we hurried up and wrote and then, stuck on a shelf somewhere and until we were ready to come back to the office. But, I think just because, people are getting vaccinated, that committee, still needs to exist. And each person on that committee has a duty for care on their responsibility that they're in the company for, right? So as we talk about some of the mandates, especially at the federal level, it's to be governed, supposedly by OSHA, right? So that's a function of EHS generally. So bringing them to the table. You're dealing with people and personnel records. Obviously, HR needs to be in the table. Again, dealing with those records and sensitive information, your chief privacy officers, your cybersecurity folks, perhaps need to be part of that conversation. We're talking about, modifying our facility, not only how we enter the building, but how we work in the building, social distancing and such. So, facilities being a part of it. I've seen quite a bit recently where security's been a part in the beginning, but now they've started for one reason or another to fade out a little bit. Personnel records. I don't want to be involved there. I think security still has a place in this committee and probably needs to double down. We try to embed ourselves in the organization to know the organization, to be able to help it. There's obviously an access granted, access denied part of this, but more so it's maintaining that partnership with all of these people on the committee. If you think about all these titles that I've just listed, it's what makes an organization run. There's no better partnership for the folks like me out there than being a part of this committee. So I think that's how when you have all of those minds in the room, that's how you can come to this workflow, this end-to-end process that Suki mentioned. And then the last piece that I think is kind of in the background of this workflow is the culture. And if we think about Maslow's hierarchy of needs, safety is one of them, right? And not only do you need to provide that safety for your employees, but you need them to be active in providing their own safety, right? So you need to get the employee feedback. On the security side, for me, it's as easy as I try to slip a question into annual employee climate surveys of, do you feel safe? Yes or no. And if you don't, what would make you feel safe? The employee should be a part of these decisions, all the way through. At the end of the day, those are the folks that you're trying to protect, and they have a voice in their own safety as well.
That's a particularly salient point, I think, that people kind of gloss over. We've been so focused on the mandate and the exceptions to the mandate and the rebuttals to the mandates, et cetera. There is an element of the emboldened employee that we're starting to see more and more throughout the pandemic and post-pandemic, where employees are looking for safe experiences. They're demanding of their employer a safe and secure workplace, and they're saying, we had one survey, 90 some odd % of employees now say that they will consider, taking action, whether that's legal, whether that's through their union, whether that's actually looking to resign if their employer doesn't provide a safe workplace. So there are, sort of the two sides of the coin where we want to address the people that don't want to provide information and maybe challenging, but we also need to address the people that just want a safe work environment, whatever that might mean. So, particularly good point. Brian, you mentioned in your comments there the notion of also working with IT and different departments, and I feel like it wouldn't be a security safety conversation in 2021 if we didn't talk at least a little bit about conversions and data and how that all sort of rolls together. There's a lot of stuff that we're going to be collecting here potentially or not collecting, and there's a lot of considerations that need to be paid attention to. So I'm going to start this one with Suki, because I know you've done a ton of research, and obviously your role at Traction Guest and your history has been all around trust and compliance. So maybe let's start off with you for how you view this issue.
Yeah, no, for sure. So definitely this is a data privacy issue and security issue. Especially, looking at the data that you're collecting, and likely it's going to be sensitive information, it's health information, and depending on exactly what proof you're requiring. And also when you're looking at exemptions, you're getting health information, the reasons as to why. So as anyone who's been following recent legislation changes, data privacy is moving really quickly, especially in relation to as a result of COVID and the information that's being collected. So there's a lot of guidance out there and requirements as well, and limitations in terms of the data that you can collect. So this is really important when you're starting to set something like this up, that you engage the appropriate team. So for us, it's privacy has been heavily involved in terms of determining, what's being collected, who has access to it, because one of the major obligations for any organization in any jurisdiction, really, especially from a European perspective, is, data minimization. Do you necessarily need to collect this data? And then also looking at data retention. How long are you holding this information for? Because, each jurisdiction or each local guidance may tell you, actually, you can't hold data for longer than it's necessary. And that may mean that once the individual has visited the facilities, that then you have to delete that data or remove that data. Or it may be, you have to hold it for 14 days for auditing purposes or for tracking purposes, and then you have to remove. Or, each organization, each location really has to make that determination. It gets very complex from a privacy perspective. And then, it's you have to also think about it from a if a user then asks or makes a request. So, from a European perspective, you have rights to request what information you hold about me. So, you have to think about the processes behind that as well, in terms of the data that you're holding. And this is all sensitive information. So
I was just saying, can you comment briefly on the HIPAA aspect? Because I know that comes up a ton. Is HIPAA is HIPAA relevant for everyone? And again, we're not giving necessarily guidance, but just at a high level, is HIPAA relevant for everyone? And is it relevant to this topic? And is it relevant to maybe vaccination versus thermal versus health? If you could do that in a minute or less, how's that?
well, from a HIPAA perspective, there's only certain organizations that are subject to HIPAA, right? And again, an organization needs to determine for themselves. So, if they're, I can't remember what the term is. Maybe Brian, you can help me. If they are an organization that provides insurance or medical facilities, they are subject to HIPAA. But from any organization, from a legal privacy perspective, you have to have organizational and technology procedures in place to protect the data. And that will be the same thing for HIPAA. You look at your privacy notifications, from HIPAA, you have to make individuals aware in terms of, what data you're collecting. And we look at privacy notices. So, when we're collecting this information, this needs to be accessible and easy to read. And then looking at the technology that's holding that information, right? Having secure technology to make sure, that there is no security vulnerabilities or checking on that. Again, that's all to do with, you may be subject to HIPAA, you may not be, but it's the same obligations for any organization when you're collecting sensitive information like this, that they need to ensure that they are mindful of when they're rolling something like this out.
Oh, that's a good point. And there's some high level, not HIPAA direct, but HIPAA indirect that needs to be considered.
I think that above and beyond HIPAA, if you're not one of the covered entities within HIPAA, probably more, topical would be something from the EEOC or the ADA, Americans with Disabilities Act. That they have a lot to say around what you can and cannot ask. I know there's been some exemptions made around COVID and such, but even if you're not bound to HIPAA, looking at those regulations and what's been amended from those folks around COVID, would be definitely a good idea there.
Yeah. No, certainly lots of consideration.
Yeah. Sorry, just to go back, and it's looking at your local guidance, your local health authorities will have that as well in terms of what's the guidance in terms of what information you should be able to collect, what's necessary and what you should not do. So again, it's going to be very specific to your locations.
Yeah, location and obviously industry. To Brian's point, whether you're a covered industry, covered entity or not, there's some complexity. But great points on data sensitivity, data minimization, data deletion, and you had said this much earlier, Suki, the notion of creating a policy of consistency. So, making sure that whatever you're doing it consistently. You have a process in place, and it's not haphazard.
Yeah.
I want to switch it over to Brian just for a minute on the data. Suki certainly covered a lot about the sensitivity and the issues thereof. Can you talk a little bit further about sort of data and maybe the opportunities, the more positive side of things?
Yeah, I think on my side, as a security person, I don't bring money into the company, right? Security, as they say, is a cost center, and I hate that phrase itself, but in some respects, it's true, right? So I need to track my contribution to my organization and justify my existence pretty regularly. So for me, having data is very important. And so I don't advocate that you hold anyone's PPI or anything. You can work with these documents and the proof that you're doing in flight rather than at rest, as they say, right? You don't need to store this information. You could maybe leverage a tool that reads the information, processes it in real time, gives you the green check mark or the red X, and move on, right? You don't need to store that, but what you are storing is the metadata about that event, right? I've got 100 employees. I've screened 99 of them successfully. I've got one exception. That's the information I think that not only helps you as the security person, facility person, HR person. It helps justify when you need to show that you're practicing the duty of care, you're keeping the safety of your employees in mind. And at some point, if they're not actively involved in the writing of the policy, some executive is gonna come around asking for this information anyway.
Yep. That's for
just to add to that as well. Sorry, just to add to that as well, in terms of the use of data, right? Like from an aggregate perspective, that's fair game, right? And I think that's great for companies to be able to capacity plan, right? And then also look at, what are, is there certain areas that require additional health and safety measures as, from overcrowding, is there enough space, et cetera. But also being mindful that the data that's being collected in the form that it's being collected is only used for the purposes for, what you've said that they're going to be used for. So again, being mindful of who has access to that data and how they can then pull reports from that, because, that's one of the pitfalls and possible liabilities for companies is, everyone has access to the information of vaccines. And again, you have to limit that. And be very cautious in terms of what systems hold that information.
No, good point. And I think that goes back to sort of policy and implementation and the rigor that we need to think these things through. Again, it's not just a yes, no, survey monkey question and then off you go. There is a process involved. There's consistency. There's escalation paths. There's permissions, et cetera, et cetera. So lots of consideration. I really like Brian's comment though around there's the data, but then there's the metadata. And that might be what we look at in terms of proving the efficacy of these programs, getting audit ready for future, and again to the previous comment about supporting employee well-being and employee confidence, making sure that we can demonstrate that we have addressed sort of that duty of care mandate. I know we're going to come close on time. I do want to just close off with maybe some consideration and next steps. Like, look, we've been through a lot of discussions here, a lot of different points. We talked about vaccinations and the unvaccinated, different proofs. We've talked about the scope, addressing contractors versus employees and visitors. We've talked about the workflows and watch list automations. We've talked about audit trails versus data minimization. There's a lot of stuff, and I mean, again, if we leave folks with anything today, I hope it's an understanding that this is clearly not a quick app that I develop on the weekend, or a little survey sign-in form, or whatever. This, frankly, it's not an app. It really is a robust sort of process that people need to look at and consider a lot of different aspects. I want to maybe turn it just quickly for some closing comments. Maybe I'll start with Suki. In terms of what people should think about as they look at what do I do in the next day, maybe in the next week, not even in the next month because there's not enough time, but in the next 2 to 5 business days, what would be your top few considerations?
I think for me is making sure you have a cross-functional team that's looking at this. So the biggest thing for me is engaging your legal and then engaging your privacy teams. in terms of, what are your requirements for each office, and then also the privacy aspect of it. So those are really key for me if those haven't been done already. And then them being fully engaged throughout the whole process, and again, reviewing and consistently applying, and then continue to monitor, manage that throughout, the implementation.
Perfect. I like your comment about managing the implementation, so not just as a one-off, but that ongoing review. Absolutely. I'll turn it over to poor Brian that didn't even get a nod. Suki wants legal and compliance on the committee. Brian, who else should be there, and what do you think are some of the next steps?
Yeah, in terms of the committee I mentioned before, I think EHS, facilities, security, the people I deal with, very, very often, they all have their viewpoints. Next steps for me, like I said, keep that committee in place. There's still a lot more to be done. We're not out of the woods yet, so to speak, right? Some mentalities may say we're not going to be out of the woods, right? The new normal, as they say, there may always be some kind of health aspect to the security and safety programs that exist today, tomorrow, and in the future. But I think end to end. This isn't about just vaccines, right? Vaccine is just another component of the procedures and the policies that you've been putting in place, the daily health questionnaires, the contact tracing, the follow-up feedback loops. All of this still plays together. And then set the policy, decide what you need to do that's right for you and your organization, and then find the technology and the tools that help support it, not the other way around. You don't want to get stuck into a procedure or a workflow that, if you're called into question later on, it's, your answer is, well, that's the only way the tool, could do it, right? Set your requirements up front and then find what helps you in your mission to keep your employees safe.
Perfect. And that is what this is all about, is keeping employees safe. We have run out of time on today's sessions, but I would encourage folks, continue to send those questions. Feel free to email us directly at info@tractionguest.com. Myself, Brian, and Suki, we thank you for your time. We'll be responding to everyone's questions. And, as Brian mentioned, just in closing, certainly there's a lot of good policy and procedure work. There's a lot of good implementation considerations, and then there's a lot of tooling considerations. And we are quite happy to help walk folks through further and deeper discussions on those issues and some of those considerations, and how to tool up and operationalize your COVID vaccination policies. Thank you very much for your time. And again, please feel free to reach out to us at info@tractionguest.com.
All right, thank you, everyone. Unfortunately, we have run out of time. As a reminder, any questions will be forwarded to today's sponsor, or you can email info@tractionguest.com. Also, we hope you take the time to share your feedback through our survey, which will open in a different screen after this webinar. Your input is important because it'll help us improve our future webcast. This ends today's Safety and Health Magazine webcast. I'd like to thank Traction Guest and, of course, all of you who joined us today. Take care and be safe.